Thank you very much for inviting me, and I'm really happy to talk about my work. So I'm going to shift to my screen now. So this is the outline. So I'm just going to have 4 parts. I'm going to first of all talk about what got me interested in Reiki. And I was initially a skeptic. I had never heard of Reiki before. So I'll talk about how I got interested in Reiki. And I will mention my experiments on rats, Reiki experiments on rats. That were my first experiments involving Reiki. Then I'll talk about my Reiki experiments with people, focusing on blood flow in the fingers. I'm sure you all know that when you do Reiki, you've all experienced heat, especially in your hands. So I have a device that actually measures the blood flow and images the blood flow in the fingers. And then I'll talk about a couple of clinical studies I did looking at effects of Reiki on range of motion in people with shoulder issues, shoulder restrictions, and then total knee replacement. Then I'll give a short summary of findings from other Reiki research. And then I will address the question of how does Reiki work? Of course, nobody knows exactly how it works, but there are some interesting ideas of how it might work. And I'm going to focus on the importance of gassho breathing there too. So, what got me interested in Reiki? Well, I have to go back way decades ago when I was a physiologist, or I'm still a physiologist, but I was working on blood substitutes. So companies were trying to develop substitutes for real blood because there was a shortage of donated blood. This was all in the AIDS epidemic, so it was difficult to get good real blood. So companies were trying to develop blood substitutes. And I had a couple of grants to test these blood substitutes, injecting them into rats to see if they caused any damage to the blood vessels and to the intestine. And I was working at that time at the Veterans Administration Hospital in Tucson, and it was very quiet there. Not many people were doing experiments on animals. And so I had my blood substitutes rats. I'd inject the blood substitutes. And unfortunately, that did cause inflammation and damage to the blood vessels. And none of those products were ever approved in the United States or in Europe. Anyway, and then the control rats had saline injected and they were fine. And then I moved to the university and my experiments didn't work anymore. So both sets of rats showed inflamed intestine and damaged blood vessels. And so the only thing that had changed was where I was keeping the animals. And I discovered that the new animal facility was very noisy, lots of people coming in and out, doors slamming, machines starting up. And I observed the rats and I thought that they were getting stressed by the noise. And I got a grant to study the effects of noise on the rats and did in fact find they were getting stressed by the noise. And so at that time, I needed a technician to help me analyze data. So I hired somebody who turned out to be a Reiki master. And that's how I found out about Reiki. And she was very persuasive, and she persuaded me to learn what Reiki was and to learn some Reiki. I think she trained me in level 1. And she said, well, maybe we could try Reiki on the rats to see if it reduces their stress. So this slide here, this is just to show you what the noise was doing to the intestine in the rats. So if you look on the left there, you can see this is actually the intestine here, small intestine, and these are blood vessels leading to the intestine. And this layer of tissue, a thin layer of tissue that you can't see holding the gut together is called the mesentery. And in the mesentery are these immune cells called mast cells. And when they are intact, this is what they look like. And then they will when they're perturbed, they explode and release cytokines, chemicals that damage tissue and cause inflammation. And this is what was happening with the noise. These cells were exploding and releasing these chemicals that were causing inflammation. So then we did some experiments with Reiki. This is rats in a quiet room. This is injecting the circulation with a protein, fluorescent protein, to see if any damage is being caused by the noise. Here there's no damage. And then if you look on the right, this is a rat that's in the noisy facility, and you can see that the protein is leaking out. So there's a lot of damage in the blood vessels there. So then this is me posing a long time ago, but we hired Reiki practitioners to give Reiki to the rats. And you can see here the rat cages, and there are 2 rats in each cage. And we had practitioners give Reiki to the rats for 15 minutes every day. And so they were in this noisy facility, and we wanted to see if the Reiki would reduce the damage that the noise was causing. So the results, 15 minutes of Reiki per day for 3 weeks, significantly reduced the leaks or the damage in the blood vessels that were caused by the noise. And we got that published in 2006. And this is just a diagram to show, to summarize what we found. So number of leaks and how big the leaks were. Remember, leaks in the blood vessels mean damage. And this is in a quiet room, so very small number of leaks. This is in the noisy facility, lots of leaks, lots of big leaks. And then this is with Reiki. And so 15 minutes of Reiki a day can significantly reduce the number of leaks and significantly reduce the area of leaks. So huge healing effect of the Reiki. And then we had one group of rats, we gave sham Reiki. That meant that somebody sat by the rats who was not trained in Reiki, just sat there. And you could see there was a slight reduction in the number of leaks and the area of leaks, but it wasn't statistically significant. So that's interesting. Just sitting with the animals did seem to comfort them and reduce the stress, but nothing like the Reiki. So this is really what got me interested in Reiki, and being a scientist and seeing that you could give Reiki to rats and heal this considerable damage in their intestine caused by stress. That was pretty compelling to me. And so it made a big change in my life, actually, because I completely stopped doing animal experiments. I just couldn't do that after I started doing Reiki. And I stopped working on rats, experiments where you have to cut the animals up. And then I moved on to just doing non-invasive experiments with people. And also I work with horses as well, making measurements on horses that just involve putting a belt around the girth area. So nothing invasive. I just can't do that anymore. So concluding those experiments, we found that double-blind controlled experiments on rats show that Reiki significantly reduces noise-induced intestinal inflammation and leaks in the microvessels, the small vessels. So double-blind controlled meant that we had different groups of rats. Some had Reiki, some didn't, and the people analyzing the data didn't know which animals were in which group. Okay, so as I said before, I couldn't do animal experiments anymore, so I switched to working with people, non-invasive experiments on people. I was fascinated by Reiki and by how it could heal. And being a scientist, I wanted to see if I could get hard data on what the Reiki was doing, what benefits it was giving, because I really feel that if we can get numerical data on what Reiki does to people, how Reiki heals people, it will become much more easy to get it accepted in mainstream medicine. And I think that's really important, because from what I've seen, Reiki is just so beneficial in so many ways, with the with the physical body, the emotions, the spiritual aspects. It really works on all three. And I think, as I've seen from reports of people working in hospitals and from my research and other people's research, that Reiki has amazing benefits. And so it would be so good to have it more widely accepted in medicine. So here in this slide, you can see someone's placing their hands under this machine here. And this is called a laser doppler perfusion imager. So that's a very scientific sounding term, but basically it images blood flow in the hand here. And so on the right, you can see this hand. This is the real hand. And then it's color coded here. Blue means there isn't much blood flow. And yellow and green means there's a medium amount, and means there's a lot of blood flow. So you can see this person has high blood flow, particularly in the fingertips here. So we use this device because, you know, we know that Reiki makes people's hands hot when they're giving Reiki, and also when people are receiving Reiki, they sometimes feel hot. So I thought, oh, wouldn't it be fun if we could actually image what was going on in the blood vessels in the hands of Reiki practitioners. So I put an ad out, and I got 30 Reiki masters to come and participate in the experiment. And so what they would do would be, they would have their hands scanned by this laser Doppler perfusion imager, and just for a few minutes. And then I would ask them to let the Reiki energy flow through them, to give Reiki to themselves. So self-administer Reiki, and their hand would be scanned again. And then I'd ask them to stop and scan their hand again. And so here's an example on the left. This is an example of someone having their hand scanned before they do self-Reiki. And you can see there's a big blue area where there's not very much blood flow, and then some round about the joints, the finger joints, you can see there's some green and some yellow and a little bit of red here. Then they start doing the self-administered Reiki, and you can see the difference almost immediately. You can see the fingertips here are bright red. There's much more yellow and green here, meaning there's increased blood flow in the fingertips. So here we have average results from 30 Reiki masters and 30 control participants who had their hands scanned, but they didn't do Reiki. They just gazed at like a calm picture. And so on the y-axis here, the vertical axis, this is the change in what's called perfusion, or amount of blood flow, change in the amount of blood flow in percent. And then the bottom is time, and each time point, each unit represents just over a minute, 1 minute, 15 seconds. So this whole thing is 15 minutes. And the filled in, the solid circles here show the average of the Reiki masters. So this is how much the blood flow was increasing as time went on. So you can see the blood flow is increasing. Then you see a sudden drop here. So this first part here is when before they were doing Reiki. Then you see this sudden drop. This is when they start doing Reiki. So the blood flow drops for just like a minute while they're starting to do the Reiki. And then you can see they start the Reiki and the blood flow kind of floods right back. You see it increases at 25% greater than the control, than before they do the self-Reiki. And this is when they stop the Reiki, so it kind of plateaus off here. So it's interesting how it drops just when they're starting up the Reiki. And I think this must be when they are maybe stating their intention and doing the symbols, And that involves some effort, some focus. And I think that's when the blood flow to the fingers drops for a while, because they perhaps it's going to the brain instead, because they're focusing at this point. And then the Reiki starts and the blood flow in the fingers increases. Then the control, these triangles, upside down triangles, this is a control. So the blood flow does increase a little bit at the beginning. Maybe they're just kind of warming up in the room, but you can see we're not getting that increase, that huge increase we got with the Reiki. It just kind of plateaus off around about 10%. And then the open circles, this is what's called reconnective healing, another kind of energy healing. And you can see that it's showing the same pattern as the Reiki masters. So we're seeing this initial increase, then a drop as they start the reconnective healing, and then it goes up again. But you can see it's nothing like the extent that we see with the Reiki. So Reiki really seems to be specific for increasing blood flow to the fingers. So I'm going to move on to more clinical experiments now. So this was looking at people with impaired range of motion in their shoulders, meaning that they found it difficult to raise their arms up above their head. And we had 78 patients, and they had various things wrong, including arthritis and injury, bone spur, reasons for why they had an impaired range of motion with their arms. And we had 5 groups of people, 15 to 17 people per group. One group got no treatment. One group got sham Reiki. This is just a 10-minute treatment. One group got 1 10-minute treatment of Reiki, 1 reconnective healing, and 1 physical therapy. And we were interested in how their range of motion improved and whether or not they had less pain when they raised their arms up. And this is basically what we asked them to do. We asked them to raise their arms as high as they could. And then we could use the videos to measure the angle with which they could raise both their arms. And so the results here, so these are the 5 groups. So this is group 1, the control, no treatment. And this is before treatment, this is after treatment, but there's no treatment here. And then this is the sham Reiki, so absolutely no effect. And here we're looking at range of motion, where the higher the number, the higher the range of motion, the higher they can lift their arms up. Number 3 is physical therapy. So there was an increase in range of motion with physical therapy, significant increase. Number 4 is with Reiki. For some reason, the people coming in who happened to be in the Reiki group, randomly assigned to the Reiki group, they happen to have a very, very small range of motion. So they were very much impaired. And you can see the Reiki really significantly improved their range of motion. And then reconnective healing also had a big effect on range of motion. So what we found basically was that the Reiki significantly increased their range of motion, which is something you can objectively measure. And it was just as effective, if not more, than physical therapy. And then the pain. So how much was the pain reduced? This is pain before and pain after treatment. This is no treatment. This is sham Reiki. And it's interesting here that there was a kind of placebo effect. Sham Reiki, just people seeing somebody who was supposedly healing them, even though they weren't, significantly reduced their subjective pain report. And then this is physical therapy, also reduced their pain. Reiki reduced their pain, and reconnective healing did as well. So the only thing that didn't was having no treatment whatsoever. But with the range of motion, which is a more objective thing rather than subjective, Reiki had a significant effect, whereas sham Reiki didn't. And then I'll quickly move on to the knee replacement experiments. So this was done in a hospital, people going in for knee surgery, complete replacement of their joint. And we had 3 groups of people. We had, I think, between 15 and 17 in each group. And we had a Reiki group, sham Reiki, and standard care. And these numbers are how much pain improved, where 1 is the most improvement and 3 is the least improvement. So you can see Reiki scored number 1, the best for improving pain, the best for reducing the amount of pain-killing medicine, the best for reducing anxiety, the best for reducing blood pressure, the best for staying in the study. People who were in the sham Reiki group, they although it was a blinded study, they could see that the sham Reiki was not having much of an effect, and it was difficult to keep them in the study, and especially the standard of care. They didn't really want to be in the study either. So the Reiki people stayed in the study and also got discharged from hospital sooner. So that's huge. If Reiki can get people out of hospital faster after complete knee replacement, that is huge for saving money in hospitals. I'm quickly going to talk about the what's called the Touchstone process. So this was started by William Rand, who is head of the International Center for Reiki Training in the US here. And he got together a group of scientists, including me, and we put together a process by which we could evaluate the scientific research that was done with Reiki. So we reviewed all preclinical and clinical studies, if they were full-length papers published in peer-reviewed journals, meaning that the articles were evaluated by other scientists before they appeared in the journal. So they had to be peer-reviewed and made sure that they were robust scientifically, relevant to Reiki. And at this point, we were not doing case studies. So this is pure Reiki research. And this is an ongoing process. So we meet once a month by phone, and we have 2 evaluators for each paper that we discover that month. And then we write a summary of the study that is on a website, Center for Reiki Research, all one word, centerforreikiresearch.org. So anyone has access to that. And as of now, we have 83 articles summarized. Most of them are quantitative, meaning that they measured something that required an objective measure with numbers. 9 were qualitative, which they were more subjective, but most of them were quantitative. So you can see that there are quite a few studies on Reiki research published in good journals, peer-reviewed, that are published, 83. And this is a summary of the quality of those articles and the number of articles that we found the most useful, that gave the most useful information. And here we have the year. This is starting at 1996, and the number of articles, 1996, and then up to 2019. We have, so each of these little segments is an article, a useful article. And it's color-coded for quality. So if we're looking at the green, the turquoise, and the dark blue, those are higher quality studies. So if we're looking for higher quality studies, you can see that as time progresses, we're getting more of those, these blue and green ones. To bring you up to date, we have 2 more that should go in here, 2 more good studies for 2019, and 2 more good studies so far for 2020. So you can see that Reiki research is increasing with time, and the quality of the studies on the whole is also increasing. And looking at these studies so far, we can see that the most rigorous data suggests that Reiki's positive effects are in 4 main areas. Reiki is really good at reducing chronic pain, also acute pain as well, at reducing stress and depression, at allowing people to relax, and especially if you're in a hospital, it can be very stressful to be in a hospital, and a Reiki session really helps people relax and also helps the practitioners. So there are quite a few studies with nurses. Nurses are very stressed. Many of them suffer burnout. And it's been shown in several studies that Reiki really does improve their level of well-being and reduce symptoms of burnout. And recently there have been quite a number of studies on people who are receiving chemotherapy for cancer. And Reiki has definitely been shown to reduce their anxiety, reduce the side effects of the chemotherapy, the pain, mainly the pain. So pain and anxiety are reduced by Reiki for people who are undergoing chemotherapy for cancer. So that is a really big benefit of Reiki now. So these, I think, are really, the reason this research is helpful is because it gives us pointers. It shows us how Reiki can be used most effectively. And these really are the four main areas where Reiki shines, Reiki really helps. And I'm not saying throw away all medicines, not at all. I think Reiki is very useful as a complementary tool that helps. It helps the medicines work better, actually, because it makes people less anxious and more relaxed and lets the medicines do their job much better. So Reiki in conjunction with other medicines, and Reiki by itself as well, of course, is very effective when used in this way. So just a couple of new studies that have come out, I thought were very interesting. So one was Reiki being effective at reducing chronic pain in 30 military healthcare beneficiaries. So this is the first study I've seen where the people receiving the Reiki are in the military. So you would think perhaps they would be more skeptical than the average person. But in the study, they not only gave them Reiki sessions, they also gave them education in Reiki. And over 80% of them said that they would consider scheduling Reiki in the future. They were so, they found it so beneficial. And then another recent study, which I was involved in, this was looking at people. This was not done in a hospital or a lab. This was just people, Reiki practitioners working from their homes. We had over 1,400 people in this, 1,400 people received a single Reiki session from 99 Reiki practitioners working in their homes. And they showed significantly improved mood and well-being. This is just after a single session. And positive effects on pain, drowsiness, tiredness, nausea, appetite, shortness of breath, anxiety, and depression, depending on what if that was present or not in that particular person. So very wide-ranging beneficial effects of Reiki, just a single session of Reiki. So to conclude from these studies, an evidence base is emerging from the newer, better designed pilot studies and from a few larger scale studies with Reiki. And we do really need more of these larger scale clinical studies to convince people in the medical field that Reiki is really working. So randomized controlled clinical trials where we have groups that receive Reiki, groups that don't receive Reiki, groups that receive sham Reiki, and the people who are analyzing the data are not aware of the grouping. That's randomized controlled clinical trials. So to finish, I'm just going to talk about possible models for how Reiki works. We all want to know, how does Reiki work? Well, of course, nobody knows for sure how Reiki works, but there are some interesting ideas. And this is one I'm going to throw out that was proposed many years ago by Dr. Becker and has also been presented more recently by Jim Oshman. And it all starts with lightning. So there's always somewhere in the world, there's a lightning storm going on. And the lightning actually bounces off the surface of the Earth and then off the ionosphere, a layer of the atmosphere. So it's continually bouncing around in the Earth's atmosphere, the lightning. And it actually sets up what's called a standing wave, which vibrates at a certain frequency. And that frequency is 7.8 hertz, or cycles per second. And that is exactly the same as the alpha brainwaves that are produced during relaxation in our brains. Exactly the same frequency. And so the idea is, maybe this wave, this called Schumann resonance, the lightning wave that is always in the Earth's atmosphere, maybe that is kind of entrading our brain waves to this alpha rhythm. And this alpha rhythm is consistent or associated with relaxation, deep relaxation. And then the brain waves don't just stay in the brain, they pass throughout the body through what's called the perineural system, the outer sheaths of the nerves. The electricity can be conducted all through the body, and then perhaps this is what is the source of the Reiki, this Schumann resonance, aligning our brain waves, and then the electricity passing through the body, through the hands, and then perhaps this causes injury repair. Maybe this is how the Reiki works. That's just one possibility. And so if we have this energy coming through, wherever it comes from, if it comes from the lightning or wherever it comes from, how does it then affect your body and other people's bodies? Well, one possibility is through what's called the biofield. And I'm just going to skip to another diagram here. So each living organism has what's called a biofield around them, which is a field of information. And it's a field of information around you, partly electromagnetic, but also can be other things that we don't even know about. And this field, it is produced by the heart, mainly by the heart, but also by the brain. It's been measured. We know it's there. It can extend like 15 feet away from your body, and it vibrates. It vibrates according to mainly your heart rhythm, but also your brain waves as well. So this field is vibrating at different frequencies, and one field of one person affects the field of another person. That has been shown. So if your field is vibrating at a certain frequency, it will cause the other person's field to adapt to that frequency as well. And so it's possible that the Reiki passes through you and it will change your field. And if your field is changing, the vibrations of your field changing, when you put your hands near somebody and when you're doing Reiki, then their field will change as well. And if their field changes, then that will induce changes in their body, their whole nervous system, their mind, etc. So that's one way that perhaps Reiki is manifested, how it works, what it does to you, and then how it affects other people, perhaps working on what's called their biofield. And just to finish, I'm going to show you, first of all, the importance of gassho breathing. Dr. Usui did gassho breathing with his students. Remember, that is when you breathe in, breathe the Reiki in through the crown. So let's just do it. Breathe the Reiki in through the crown. So it fills your entire body. And then a slow out breath, letting the Reiki go out of every pore of your body, out off to infinity as you breathe out. Nice, deep, slow breathing. Breathing the Reiki in. Breathing the Reiki out. And Dr. Usui he knew that the breathing helped the Reiki flow better, but he didn't have the scientific equipment that we have now. And so this is recordings that I've made. So this is heart rate along this the y-axis, and then time along the x-axis here. And this is just 3 minutes. And this is how your heart rate will change. Even if you're just sitting down doing nothing, your heart rate doesn't just stay constant, but it just kind of varies. That's healthy. It's just heart rate adapting. But then if you do the gassho breathing, you can see this very rhythmic pattern happens. And this is in time with breathing the Reiki in, the heart rate goes up. Breathing the Reiki out, the heart rate goes down. So this pattern happens. This pattern just doesn't just stay in your heart. It is going out to that biofield as well. And this has been shown scientifically too, that your biofield starts vibrating with this same frequency that you get with the gassho Reiki breathing. And just to finish, I'm going to show you that animals, especially horses, are really sensitive to the vibration of the field. So you can see this horse here. And I'm going to, this is a video, very short, and you can't see her, but there is a student sitting in that pen there with the horse. She has a little device that is telling her when she gets to that what's called coherent state that you saw with the gassho breathing, that steady rhythm of the heart going up and down with the breathing. So she's doing the gassho breathing, and you're going to see how what this horse does. And I want you to look at the horse's ears. So I'm going to start this video now. Okay, so there's the horse. Watch his ears. Okay, now watch his ears. And when you saw his ears moving, that was when the student started the gassho breathing. So you can see that somehow or other, that horse is picking up the signal. And we've seen this countless times. So it's almost like a radio wave. And I was just thinking last night, I mean, people do distant healing with Reiki, and maybe it is like a radio wave. Maybe it can travel vast distances just like a radio wave does. So that's just something to think about. But the experiments with the horses are just really amazing. So I'm going to finish here.